21, 2026. We are streaming live spine surgery. What you're watching is laser spine surgery. This is surgery done to treat painful herniated discs in the cervical spine. We also have a procedure for lumbar spine and thoracic spine. Our patient travels to Deuk Spine Institute from Anguilla. She's from Anguilla, the island of Anguilla, which is in the Caribbean, and she spends a lot of time in Miami. So she's here today because she found Deuk Spine Institute on the internet. She came to our website, deukspine.com. She watched videos and learned about our state-of-the-art surgeries that are not available anywhere else in the world. And we did a Zoom call. I diagnosed what's causing her neck pain, being the herniated disc plus the facet pain that she had. We already treated her facet joints earlier. That's the earlier video from today. We treated her with our Deuk plasma rhizotomy for facet joint pain. So now we've flipped her over and we're doing her cervical disc repair. The procedure you're watching is 20 years old. We've been doing this surgery for 20 years. It's fully FDA approved. Everything we use is FDA approved. And the surgery has been peer reviewed and published many times in the medical literature as safe and effective for treating painful disc herniations. Now, in addition to disc herniations, we also can treat degenerated disc, slip disc, bulging disc, all of those conditions. There's a piece of herniation right there. All of those conditions I'm mentioning, slip disc, bulging disc, herniated disc, protruding disc, extruded disc, ruptured disc, degenerated disc, are all the same. There's really very little difference between all those conditions. So why do we have so many different names for the same thing? Don't ask me. I didn't come up with all the names, but it's excessive. All right. Typically we have one name for things, sometimes two, right? But for some reason, when it comes to understanding neck pain, doctors are at a loss. They don't really understand what causes neck pain. And I was brought up in a medical system that said neck pain has no cause. Back pain has no cause. We don't know the causes. We can't say why somebody has neck pain. We'll just call it fibromyalgia. And for years, patients were diagnosed with fibromyalgia, an uncurable condition. And they were told they need to take pills, medicine, and shots, but nobody could ever find permanent relief from their neck pain. Until Deuk Spine Institute came along. 20 years ago, we discovered the actual cause of neck pain. And there's really two major causes of neck pain. One is disc pain. We call it discogenic pain. We're referring to your spinal discs, which are located between bones in your neck. We call those spinal discs. And they're made up of a ligament, a circular ligament called the annulus fibrosus, that wraps around the disc on the outside, and a jelly in the center called the nucleus pulposus. So between the annulus and the nucleus, you have a disc. What happens, unfortunately, all too often, is that people get an injury to their neck, trauma, like a car accident or a slip and fall. That's a bone spur, by the way, right there. And when they get that traumatic neck injury, they get a whiplash. And in the whiplash, their bones suddenly move in a very abnormal way. One bone goes left, one bone goes right, and the patient ends up getting a tear in that ligament. Just like if you tore the ligament in your knee, for example. Okay, it's no different. You get a ligament tear in your neck, it's called an annular tear. And then, over the next few years, that annular tear becomes painful. And the way it becomes painful is quite simple. You get nucleus pulposus herniating out through the tear, like these pieces right here. They get stuck in the tear, in the outer half of the tear specifically, and they cause your body to do what's called inflammation. Now, if you've ever had a zit on your face, you know what inflammation is. Zits are painful. If you press on a zit, it hurts. Imagine a giant zit in the back of your disc. That's what is happening. And I'm here with the laser to clean out that zit and pop it, basically. Now, a zit causes inflammation because you get bacteria. Bacteria are pathogens, we call them, microscopic unicellular organisms that live on your skin. And, you know, if you're not careful, and with hormonal changes, those bacteria can actually start to cause an infection where they grow into your body and they start to invade. And of course, your body is not just going to let some bacteria invade. It's going to fight that invasion. And the way you fight the invasion is through a process called inflammation. So that's what's happened. Your body's inflammatory system is attacking, and it creates redness, swelling, and pain. Okay, redness, swelling, and pain, and even a little extra temperature. All right? So that's what's happened with her in the back of her disc at C5-6, C6-7, and C4-5. So we're here to perform the Deuk laser disc repair at these 3 discs. Let's show the audience those 30 different causes of neck pain, the disc herniation accounting for about 85% of all neck pain. We're going to move from C5-6 disc down to C6-7.
I'm Dr. Deukmedjian, CEO and founder of the Deuk Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3, next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Deuk plasma rhizotomy is the best treatment in the world available for painful facet joints. Deuk laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes.
Welcome back. We are moving from the C5-6 disc down to C6-7. Our plan is to treat 3 herniated discs. Perfect. C5-6, C6-7, and C4-5 in that order, starting with 5-6. We're now at 6-7 because we've completed 5-6. We're entering the disc. We're going to the back shot. We're going to do a little discogram. Any questions from our audience so far about our laser spine surgery here at Deuk Spine Institute in the cervical spine?
Yes, we have a question from Rusty on YouTube.
Hi, Rusty.
I am Rusty from Georgia. You have fixed my T8, T9 late last year. Now I have a bulging disc at L4, L5, and L5S1 with sciatica and neuralgia. Neuralgia?
Neuralgia.
And could this be the cause of burning and pain in my back?
It could, Rusty, but, to be honest, the best thing to do, people ask me questions all the time over the stream, but I need to actually see you on Zoom to be able to make a diagnosis. So if you could just set it up, it's free, no charge. Just talk to our MRI review, talk to Nikki, and if you go to our website, Rusty, just deukspine.com, which you already know, you've been there, you probably did the MRI review already with me for the thoracic spine before we did your surgery. You just need to do another MRI review. We do it for free. I need your MRI before you do it, and I will tell you exactly why you're having pain in your lower back. Okay? But I've got to see you and do a quick exam, and I got to see your MRI of your lumbar. Okay? So I'll give you a diagnosis, no charge, and then you can decide what you want to do. All right? But let's figure out what's wrong first before we go recommending treatments. All right. We have just moved from C5-6 to C6-7 with our little tube. By the way, the entire surgery on her neck is done with a 4mm incision. You guys see that? 4mm. That's tiny. It's like a little cut. And we're not doing any damage internally because we use the dilator, which gently spreads tissues apart to get to the herniation. So we've done no damage inside, which is why patients don't need pain medications after our surgery. When you go have an ACDF, anterior cervical discectomy and fusion, or a posterior cervical fusion, or foraminotomy, laminectomy, all those surgeries done are far more invasive than this surgery, and they don't work very well. They work very poorly at eliminating pain. A lot of them cause more pain than they cure. But our surgery has a 99% cure rate of pain. Pain from a disc herniation, okay? If your pain's coming from something else, then it won't work, obviously, if we're operating on your disc. The pain needs to come from the disc to fix it by operating on the disc. That's obviously common sense. So if I want to fix your neck pain, I got to know where it's coming from. And to do that, I have to do a quick MRI review, which takes literally 10 minutes, and I can diagnose what's wrong with you. As far as treatment, you'll have to travel to Deuk Spine to get our treatments because they're not available anywhere else in the world. This patient came from the Caribbean island of Anguilla, an island I've never been to but have wanted to go to. I've heard great things about this island. It's rated one of the top 10 islands in the Caribbean, Anguilla, and apparently it's got beautiful hotels and great food. I just wish I had more opportunity to go because that's my favorite, Caribbean islands. I'm an avid scuba diver and snorkeler. I love being in the ocean. All right, any other questions?
No questions.
So you can see here at the bottom of this tube. The bottom of the tube is literally right on the herniation, right where the tear is. And I'm using the laser to clean this tear. The tear will never heal on its own. All it does is build up scar tissue from inflammation after inflammation. And that scar tissue starts causing really bad pain. And that's what she has. So once I fix this for her, she's not going to have that neck pain anymore. It's going to be gone. And I'm very excited. There's a piece of herniation right there. You guys see it? I'm trying to float it out, but it won't come out. It's too big. So I'm going to reach in and grab it. Thank you, Luis. Thank you. You guys see the grabber here?
Yeah, we see the grabber.
Switch to the eye in the sky. I know you see it, but the audience may not see it if you don't switch. And here's the piece of herniation right there. Can you guys see this?
Wait a second. Now we can.
Oh boy. Anyway, there's a piece of herniation. We've taken out about 10 pieces of herniation already from this disc. There's the number 11. There's 12 right there. Any other questions from our audience?
No questions.
All right. Flip it. In that case, let's show the audience how herniated discs in the neck are the number one cause of neck pain for patients.
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK-349.
It's out. Yeah, it's out. All right, well, I'm not seeing. Maybe it's getting kinked. I don't know. Luis, watch the line. Any questions from our audience?
No questions.
All right. And we showed the audience the video on how a disc in the neck causes neck pain.
Yes, we did.
Did we show them how we fix a painful disc with our laser spine surgery?
No.
Let's do that.
Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4mm skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debrides the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK-349-6963.
All right, well, welcome back. You can see from our video, we use an endoscope to enter the annular tear and find the tear. That's what we're looking at right now. This is a huge tear in the back of the C6-7 disc, and there's a herniation right there where the laser is. Now that laser is 0.5 millimeter wide. Just to give you a perspective on how big it is, that's 0.5 millimeter. A millimeter is the tiniest space. If you take your fingers and spread them apart, just enough to see light between them with your eyes, that's a millimeter. This is 0.5 millimeter. So how are we able to see it so big and magnified? That's what the endoscope does. It allows magnification of the view, which enhances safety of the procedure. Yeah, I think the problem is going to be the pressure on your irrigation, right? You know why? Because what keeps the line open? What keeps a balloon from flopping? Pressure. Yeah. All right. So what normally keeps that line from closing? Pressure. So your problem is probably the pressure generated by that machine. By the machine.
Can you check the
It's what? 700 psi? No way. 700? Huh? Millimeters of mercury. All right, we're done with 6-7. We're going to move up to number 4-5. It's our last disc that we'll be fixing for this patient. We've already fixed number 5, 6, and 6, 7. Next is number 4, 5. So we're going to move out of this disc herniation. We're going to move up to number C4, 5 disc herniation. We're going to go to the back of the disc herniation at C4, 5. We're going to use the endoscope to find the tear and herniation. And I'm going to use the laser to clean out the herniation from the tear and do a debridement. You will never see this surgery anywhere else in the world. I pioneered it myself 20 years ago. We've been doing this 20 years. Kimmy, ask Anthony how many Deuk laser disc repair surgeries we've done in the last 20 years.
We have done 2,787.
2,787
I believe.
Deuk laser disc repairs. Coming up on 3,000 surgeries with this laser spine surgery. So you want to know why Deuk Spine is the best in the world at laser spine surgery? We have the best technique and we have the best results. All right, shot. Who's moving that? Oh, Sam? Shot. I got to be able to see. I'm not able to see, guys. Jordan, you're too far north. That's pretty good right there. Just stay there for a second. I'm sliding the sheath out, leaving the dilator in. Shot. I'm going to come out of the C6, 7. I'm going to move back up to C5, 6. And I'm going to go past C5, 6 up to C4, 5. Let's go ahead and get a shot. Perfect shot. All right, so I'm making my way up, but I'm a little bit to the side. I've got to figure out which side I'm on and correct it. I think I'm going to be on the right side. Shot. Yep, I'm a little bit to the right. Stay there. I'm going to correct it. Perfect. Now I can feel I'm on the anterior longitudinal ligament of the spine. Perfect. Lateral. So we're going to move up the spine. Now notice the entire surgery is done with a 4 millimeter incision. I'm fixing 3 disc herniations in the neck. 3. With a 4 millimeter Band-Aid incision. No bleeding, no hospital, and we've never had a complication. A surgical complication, never. So all those complications you get, AP, from ACDF, 50% complication risk with anterior cervical discectomy infusion, 50%. It's published at 50%. You have maybe a 40% complication rate with artificial discs in the neck. And with posterior cervical laminectomy, it's a 25% complication rate. So all these surgeries doctors are recommending for you on your neck are highly invasive, they're dangerous, they have high complication rate, and they have a very low success rate compared to our surgery. Our surgery has a 99% cure of neck pain and radicular symptoms. All right, there's your discogram. You can see the dye shot leaking out through a tear in the back of the disc. There's actually 2 tears, one above and one below. I'm going to advance my dilator. Shot. And let's just do a quick count. 2, 3, 4, 5. We're at C4, 5. Everyone agrees? All right. We're going to put our tube down. The entire surgery at Deuk Laser Disc Repair is done through a tiny 4 millimeter wide tube. That's why patients do so well with this surgery. All right. Very good. Any questions?
Yes.
The reason we do questions, by the way, during live surgery is so that you can ask me questions about the surgery. Sean?
Yes, we have a question.
A little bit louder.
Yes, we have a question.
Go ahead.
This is from Lanu from YouTube. He's asking, does your arm ever get tired holding the scope for hours?
Does what?
Does your arm ever get tired holding the scope for hours?
I see. Does my arm ever get tired of using the scope? No. We're trained and used to doing long surgeries. The longest surgery I've ever done, I was telling my son about this the other day, was 18 hours. It was an acoustic neuroma I did with Dr. Roper, my mentor at the VA hospital actually, on a veteran up in Gainesville, Florida. Used to be the second largest VA hospital in the state. Now it's the third. I'll get it. Yeah, you're pushing down a little too much. And that surgery took 18 hours. These surgeries are very short compared to that 18-hour surgery, so much easier for me to do. Thank you for your concern. No, my arm does not get tired. Neurosurgeons aren't like normal people. We do really difficult tasks, and we're selected for that. Not anyone can become a neurosurgeon. It's the hardest specialty in medicine to become in the United States. It requires typically that you are very sound with your knowledge of medicine. So you have to be at the top of your class in medical school, and you have to be able to handle the very fast pace of neurosurgery, because you're dealing with a lot of life and death situations every single day. People that want to die from their injuries. And your job is to save their lives. Their bodies are trying to quit. So you have to stop what's killing them or harming them, and you have to try to repair things and keep them alive and well. It's very difficult surgery, just like most surgical fields. It's very challenging. But we're conditioned, typically we work in our training for anywhere from 110 hours a week to 120 hours a week. That's 3 full-time jobs for those of you counting. And that's in the hospital working, not sleeping, laying down, playing Yahtzee or Monopoly. It's literally running around the hospital, taking care of people that are dying. 110 hours a week was my average week, and sometimes I'd hit 120. Awake, operating, writing notes, examining, ordering tests, treating for 7 years. And the ones who don't make it, which most of them do during residency, they quit and they fall out. And they become other types of doctors. I'm not going to say what types, but I'll just say radiology is a common landing spot.
Interventional radiology must make really good intervention. Coils, right?
Any other questions? Yeah. Coils and clips. Coils and embolizations. Very, very common nowadays. All right, these are pieces of herniation coming out of C4-5. We're just about done. I have 2 minutes left. Any other questions?
Yes, we have a question from Lanu on YouTube.
Sure.
On this patient, are you operating front or back of the neck?
We operate in the front. We go through the disc to get to the back of the disc where the problem is. We're in the back of the disc right here. This is number 4-5. You can see there's scar tissue. That's what I'm zapping away with the laser. There's herniation, like right there. There's a piece of herniation in the foramen sitting on the nerve root right there. See how precise the laser is? Remember, that fiber is 0.5 millimeter wide. So those blast marks where I'm removing abnormal tissue is literally 0.2 of a millimeter. Wow. We're just a little overexposed, guys. Did you white balance properly? Because it's very yellow. But you use the white part of the Raytech? I know you did. I saw you do it. I'm just wondering why it's not white balancing properly. There's more herniations coming out. We have about a minute left. If you have questions, feel free to ask. Otherwise, we'll be back shortly with our next patient who has lower back pain, and she has 2 herniated discs in her back, L45, L5S1. The pain radiates from her lower back down into both legs. We've actually done her surgery already in the past. She was a sacroiliac joint and a piriformis release. She's so happy with the results, she wants me to fix her disc problem. So remember, there are 30 different causes of back pain. We fixed 2. Now we're going to fix 2 more. And hopefully this is all she's going to need. All right, well, thanks for joining us. If there's any other questions, I'll take them. Otherwise, live long and prosper.
No questions?
All right, we're done.
Please. Sitting on, please. Thank you.
And good morning, I'm Dr. Deukmedjian, CEO and founder of the Deuk Spine Institute. I'm here with one of my patients who traveled from California with a problem in his neck. He's been having pain, it radiates down into his left arm. He has some other issues as well, like pinched nerves in the elbow and palm, which he's treating in California. But the herniated discs at 5, 6, 6, 7, we did the Deuk laser disc repair yesterday. You can see me going in with the endoscope and the laser. It's all done with a 4mm incision, bloodless surgery, and outpatient. And here he is less than 24 hours later, and he wants to share his story with you. So go ahead.
Okay, so the first thing I want to do is give Dr. Deuk a joke that I wrote last night. He's going to understand this. We might have to look some of these things up. A neurosurgeon was performing several radiofrequency ablations on patients when he started hearing loud shouts and screams in the recovery room. Shocked, he walked into the room to see what happened. The nurse ran up to him. "Doctor, things got pretty heated up for a while, but no one had the nerve to say anything." That one over there seems especially nerveless. All right, so I got him to laugh.
I like
Good
it.
stuff. Okay.
I like it.
You know, just a little
Nerveless instead of
dad
nervous.
humor there. Good
I
stuff.
love it. I love it. I love it.
What happened for me was ever since I was a kid, I was the young kid that fell off the high chair when I was 2 years old, fell down the staircase when I was 4, got tripped, hit the back of the sandbox at 6. I went in the military, I parachuted out of planes, hit my head more than once with a Kevlar helmet, then served in the military wearing Kevlar helmets, sometimes banging my head against heavy artillery pieces. Sometimes I didn't have my helmet on. Sometimes just the weight of the helmet was hurting my neck and my back.
That part about banging your head in the plane against heavy artillery pieces, sometimes you hear in the military like a helicopter went down, right? Suddenly exploded, went down. Now I know why.
Well, you know, I mean, people will say, why would you jump out of a perfectly normal airplane?
Right?
But, you know, let me just tell you, low contour flying by sea, some of the jets there makes things a little bit tough. And then after that, what I started to notice, I started to develop where my muscles in the back just became really severely tense and stressed out. I kind of thought it was work and otherwise. And then when I'd go to things like the dentist and I'd lean my head back, my entire left arm would just start tingling and sparks shooting out like crazy. And when I got back up, things were better. But then I went on a trip back in early May, and then it was happening all the time. At that point, I got an MRI done. You know, obviously at that point, I went to my primary care and I had options. There were 5 options really, if you think about it. One was do nothing, just, hey, I'm getting older, just deal with it. You know, stop being a baby and just, you know, life goes on. Number 2, maybe seek physical therapy or chiropractic care, which I did, and it helped. For some things, I had really bad posture. That was one of my issues, but it wasn't taking away the problems that I was having with the tingling doc. So then I started to seek out medical expertise in Los Angeles. First choice was full disc replacement for both the discs. The way I was thinking about disc replacement was, it's kind of like having a car. The tires are halfway worn down. You're having problems with one of the tires in the back, and you decide to replace it with a bigger tire that's different tread, different braking system. Now, it's gonna work if you're riding on a regular road or highway, but it's something different and that's working there, and it was never made for the car.
You'd be replacing it not with a different tire, but a metal tire.
Yeah, a metal tire, even worse,
Like
exactly.
a tank tread.
Yeah, and then you can't do MRIs, or you gotta find the ceramic one, which which you can. Okay, so that was disc replacement. That didn't sound attractive. ACDF, I've got some dear friends that have done ACDF. Problem there was, I was thinking of that same car analogy. Now you got the rear tires are locked in. They only go straight, they brake at the same time, the suspensions are the same, and only the front two are moving around. And I was worried about what is the effect on the disc above and below. And my mom had this problem. She had lumbar fusion with rods in her back, and then she ended up having lumbar fusion in the upper ones when she was alive. And that poor woman went through a lot of pain for it. So I was figuring, hey, look, I'm a guy that works in technology.